This is Bill. He's a regular guy with a chronic health condition. He's happy with his health insurance because they are working with him to keep the condition under control with a personalized care plan. He likes his doctors too, even though he wishes he didn't see quite so much of them. Bill's been doing a lot of walking to improve his health and decides to step it up a bit with a rock climbing trip to the Grand Tetons. Bill packs his bags and heads for Wyoming. On the trail up the hill, Bill is attacked by a raccoon again, and in trying to escape, he slips and injures his knee. He hobbles back down to his car and heads for the emergency room. Even though Bill's 1,000 miles from home, the hospital uses Availity to verify Bill's coverage and copay amounts with his home health plan without picking up the phone. The hospital's admission order triggers a flurry of action. Within minutes, Bill's primary care physician, specialist, and health plan receive notifications about his visit to the hospital. The ER doctor decides Bill needs x-rays. The hospital submits a simple online request through Availity, which passes the plan's auto-authorization rules. The portal delivers a confirmed authorization within minutes. While Bill's waiting in radiology, his care team in the ER reviews his care summary and notes his recent visits to the specialist and his chronic condition. Bill gets his x-rays and returns to the exam room in the ER. The doctors decide to admit Bill overnight for observation, so he gets a good night's rest. The next morning, Bill's doing fine, and when he gets discharged, he decides he'd rather go for a hike than climb a rock anyway. As he's wheeled to the door, the hospital's discharge order triggers new notifications to his primary care physician, specialist, and health plan that Bill's doing okay and is back on his feet. The hospital also completes the claim and adds it to the batch system for uploading through the clearinghouse. As the transactions are processing, Availity's active monitoring identifies data in the claim that doesn't match the master data record about Roger the radiologist who saw Bill. Someone must have entered a typo into the system. The next time Roger's staff logs into the portal, they are asked to verify whether the master record or the new information is correct. They select the correct data, hit submit, and every health plan the hospital is contracted with gets the updated details. The corrected claim heads to the health plan and Bill heads for the trails. Deep in the wilderness, he gets lost. No, he doesn't. Bill's been through enough recently, so we're gonna let him get back home safely. While Bill is resting at home, his health plan is hard at work, reimbursing doctors and the hospital and notifying Bill's doctor, specialist, and care coordination team about his treatment so everyone is ready for Bill's next appointment. It's also calculating Bill's health savings account balance in the wake of his short hospital stay. As the claims are processed, the plan updates the claim status so everyone can check Availity to see what's going on, and the providers don't have to call to inquire about their reimbursements. As the claims are paid, the electronic remittance advice notifications go out, and accounts receivable at the hospital can mark the claim paid on time and with no surprises. About the same time, Bill gets a call from his care coordinator, who recommends Bill set up a follow-up appointment with Dr. Quinn, his PCP. They agree on a date and time, and Bill marks his calendar. Bill recovers from his knee injury and continues to work with his care team to improve his health and eliminate care gaps. Because he's actively involved in his care, he's able to reduce his need for doctor visits and medication. When Bill's health plan and his providers work together, Bill stays healthier, everyone's costs are reduced, and his health plan gets 5-star ratings. Get the rest of the story and see how Availity is making healthcare better at Availity.com.